Hello everyone, and welcome to today's presentation. I'm excited to have you here as we explore Chapter 17, which focuses on congenital malformation, deformation, and chromosomal abnormalities. We'll be covering topics from Q00 to Q99, giving you an overview of these important areas. Over the next few slides, we'll look into the types, causes, and implications of these conditions. Let's get started. When coding for Q00 through Q99, it's important to select the appropriate code or codes from these categories whenever there's a documented malformation, deformation, or chromosomal abnormality. This means that if a patient's record shows any of these conditions, you should assign the relevant code from this range. It's also worth noting that such a condition can be listed as the principal or first diagnosis, or it can be secondary. So, whether it's the main reason for the visit or an additional diagnosis, the coding applies. Now, sometimes a malformation or abnormality doesn't have a unique code on its own. In these cases, you need to assign additional codes for any related manifestations that might be present. This helps give a complete picture of the patient's condition. An especially key point to remember is that if the code specifically identifies the malformation or abnormality, then you generally don't code the manifestations that are an inherent part of that anomaly separately. But if there are manifestations that aren't inherent or are separate from the anomaly, then you should assign additional codes for those. Connecting this to our overall theme, these guidelines help ensure we're accurately capturing complex congenital conditions and their manifestations, which is crucial for proper patient care, research, and reporting. Now, let's look at some important points about coding from Chapter 17. These codes can be used throughout a patient's life. For example, if a congenital malformation or deformity has been corrected, you should use a personal history code. Specifically, codes in subcategory Z8077, which stands for Personal History of Corrected Congenital Malformations, are assigned when the patient has a history of congenital anomalies that have been surgically corrected. However, if the congenital issue has only been partially corrected or still requires ongoing medical treatment, you should assign a code for the actual congenital malformation rather than a personal history code. It's also important to remember that some conditions present at birth, like malformations or chromosomal abnormalities, might not be diagnosed until later in life. Whenever a physician diagnoses such a condition, you should assign the appropriate code from the Q00 to Q99 range. Finally, when coding for the birth admission, you need to use a code from category Z38, which covers live-born infants. The specific code depends on the place of birth and type of delivery. This code should be listed as the principal diagnosis. Any other conditions or congenital anomalies present should be documented as secondary diagnoses. Understanding these nuances helps ensure accurate and consistent coding throughout the patient's lifetime. In this example, we're looking at a newborn male who was delivered in the hospital via cesarean section. One key detail here is that the baby has Down syndrome, which is also known as trisomy 21. When documenting this case, we use the code Z3801 to specify a single live-born infant delivered by cesarean, and Q99 to indicate the diagnosis of Down syndrome, unspecified. This example really highlights the importance of accurately capturing both the delivery method and the specific health condition of the newborn. Proper coding like this helps ensure clear communication and proper care coordination. As we move through this presentation, keep in mind how precise coding supports better data collection and ultimately improves patient outcomes. Let's take a closer look at hydrocephalus and spina bifida, two congenital conditions that often occur together. When we talk about congenital hydrocephalus, we're referring to a condition where there is an abnormal accumulation of cerebrospinal fluid in the brain's ventricles, which can cause increased pressure and enlargement of the head. This is classified under Q03 in the ICD coding system. Now, when spina bifida occurs alongside hydrocephalus, it's usually depending on which part of the spine is affected. For example, if the defect is at the cervical level, we refer to it as cervical spina bifida with hydrocephalus, coded as Q050. Similarly, thoracic spina bifida with hydrocephalus is coded as Q051, lumbar as Q052, sacral as Q053, and if the specific location isn't clear, we use the unspecified category, Q054. It's important to understand that the location of the spina bifida can influence the severity and type of neurological symptoms, as well as the management approach. The overall theme here is that these conditions are interconnected and can vary depending on the affected spinal segment. Recognizing these distinctions helps in planning appropriate treatment and providing better care for affected individuals. Now, let's take a closer look at some of the other congenital malformations categorized under Q25. These include malformations of the great arteries, such as the aorta and pulmonary artery, which can vary quite a bit in severity and impact. Recognizing these helps us understand how complex congenital heart issues can be. Moving on, neurofibromatosis, specifically under subcategory Q8050, is a group of genetic disorders inherited in an autosomal dominant fashion. What's important here is that these disorders lead to tumors developing along nerves, which can cause a range of neurological and physical symptoms. Understanding this connection is crucial for diagnosing and managing these conditions effectively. Next, we see congenital uterine, cervical, and vaginal anomalies, categorized from Q50 through Q52. These are structural issues that can affect reproductive health and development, highlighting the importance of early detection and intervention. Finally, congenital malformations of male genital organs are classified within categories Q53 through Q55. These anomalies can influence development and function, underscoring the need for comprehensive clinical assessment and tailored treatment plans. Overall, these categories illustrate the wide spectrum of congenital anomalies, emphasizing the importance of accurate classification for diagnosis, management, and improving patient outcomes. Recognizing these distinctions helps us better understand the overall landscape of congenital conditions.